Next, assess the head, eyes, ears, nose, and throat. Palpate the scalp, looking for any depressions of the skull which might indicate head trauma or previous surgery. Inspect the hair and its texture, looking for nevi, lesions, or parasites. Inspect the face, noting whether the facial expressions and eyebrows are symmetric. Palpate for sinus tenderness by pressing up on the frontal sinuses from under the bony brows. Then press up on the maxillary sinuses.
Okay, now I'm going to check your sclera and conjunctiva. Look
Inspect
up.
each cornea, iris, and lens.
And look down.
Check the color of the conjunctiva and sclera.
And
Compare the
that's good.
pupils and test their reactions to light and accommodation.
Good. All right, now I'm going to look inside your eyes. Okay, what I want you to do is look straight ahead at that dot. And just bring your head down a little bit. That's it.
With an ophthalmoscope, inspect the ocular fundi. Next, you may wish to perform a brief assessment of the cranial nerves. Cranial nerve 1, the olfactory nerve, is typically not tested unless a neurological problem is suspected. In the head-to-toe assessment, cranial nerve 2, the optic nerve, can be assessed with a test for visual acuity.
FDP, LT, FEZ, CL, O, FTB.
Good.
Cranial nerves 3, 4, and 6 control extraocular movement. Look for abnormal movements or nystagmus of the eyes in each of the 6 cardinal directions of gaze. Ask the patient to follow your finger or a pencil as you make a wide H in the air. Then test for convergence. Next, test for several components of cranial nerve 5, beginning with motor response. Check masseter and pterygoid function by asking the patient to clench his teeth. Check the nerve's sensory response by using a sharp object to stimulate the patient's forehead and cheeks at the points indicated.
Sharp.
Ask the patient to report whether the object feels sharp or dull, and to compare both sides of the face.
Sharp.
Test for light touch using a cotton swab. Cranial nerve 7 is assessed by inspecting the patient's movements of facial expression.
Shut your eyes. Keep shut. Okay, relax. Puff your cheeks.